Thank you, Chairman. And after a very exciting and outstanding presentation by Theo, I think I am a little dwarfed by the contents of his presentation. If there is anybody else who can appreciate and understand what he spoke, I think there cannot be anybody else better than me, believe me, in this audience. It is basically because I worked in the hospitals for 30 long years, and I have always worked in the large hospitals where such kind of work happens, whether it is kidney transplantation or hip replacements or open heart surgeries or whatever. I think if all that what he said is going to come true in India, I think more than 1.2 billion people will be greatly benefited. For your information, ladies and gentlemen, I am just flying down from Hyderabad, where I attended the eHealth India Conference 2013, where I had to talk on a similar subject. And it was a great gathering. It's an annual gathering by the Government of India. And every year it is held in one of the big metropolitan cities. And this time it was in Hyderabad, and the Chief Minister of Andhra Pradesh, Honorable Kiran Kumar Reddy, gave a wonderful address when he spoke about healthcare. He said that maybe the technology progression, what did not happen in the last 1,000 years, happened in the last 30 years. And those technological progressions in these 30 years has done a lot of good around the world, in the country and in the community in India as well. But he had a few questions to people like us, maybe the engineers, the administrators, the doctors. He said, with all these technologies, can you make it affordable? Can you make it accessible? Can you make it equitable? I think that way, I think it was a challenge to us. And people like us working in the hospitals are trying to find out how we could make technology affordable to the people in the rural areas. For a person like me who has worked in the engineering industries and as well as in the healthcare sector, one thing I realized is that the healthcare has not adopted, at least in India, the way the other industries have adopted technology. If you look at maybe manufacturing, if you look at telecom, if you look at banking, I think they have adopted technology much more than what we have done in healthcare industry. I think that has been the challenge, but yet we are doing well, and India is definitely catching up. As you saw in his presentation, in 1950s, when we just got the independence, our average expectancy was only about 45 to 50. But today we are in average age expectancy is about 70, and we are almost racing with Japan, which is 80, and it is not a small achievement in any way. So having said that, I have, as I told you, worked in large hospitals in the metropolitan cities like Chennai, Hyderabad, Bangalore, and also in the tier 2 cities. I think that is what made it more interesting to me, because a place like Coimbatore, Madurai, Trichy, where the real poor people live. People ask me, how did you manage to go from a place like Bangalore or Chennai to a place like Madurai and Trichy? But believe me, today, two things I realized. One is that it is possible to put in technology in such places, the state-of-the-art technologies, and implement them and make them work. It is not difficult at all. But what you require is the commitment, and somebody should champion that cause of technology in those rural areas and the tier 2 cities, and it will work. And it is more satisfying to work in those places because that is where the technology is really needed. Just to give you a very quick overview of the places where I am living and where I am working, this is the hospital. I mean, this is the temple tower of Shri Rangam temple, and it is a huge tower. It is almost about 300 feet. I don't know. It is an engineering marvel, and it is in this on the banks of the river Kaveri. And just to give you an idea, which are all the hospitals, and I am going to talk about more about the technologies which we have used in these hospitals as a case study, as the professor did. These are all the 4 hospitals from where I am going to take some of the learnings here. This is the one hospital in Chennai. This is the one hospital, the 100-bed cardiac hospital, exclusive cardiac hospital in Trichy, which has come out recently in the last 1 year. And this is the kind of facilities we have got. This is the cath lab, the state-of-the-art cath lab, and this is the linear accelerator which we have. And this is the operation theatre. And of course, I'm also going to talk to you about some of the things which I did in the hospitals where I work, like Apollo Hospital, Kovai Hospital, and Meenakshi Mission Hospital, Madurai. And it is also interesting to note that in the government hospitals in India, like All India Institute of Medical Sciences, they are doing a great job, and I had some opportunity to visit them and also work in those places. I am also trying to tell you what are all the technological advancement they have done, and they have used it to use it to benefit the population that come there. Of course, these are all some of the state-of-the-art labs which are also a part of the healthcare industry. But to quickly run through what are all the real challenges and opportunities in India today. India needs a healthcare system which has to meet the demands of about over a billion people. That is about almost about 1.2 billion people. Each year, 39 million people are pushed to poverty because of their inability to meet the healthcare costs. India leads the world in terms of maternal deaths, and there is a dearth of qualified medical professionals in the rural areas. Health insurance covers only 1/5 of the Indian population, and unorganized private sector accounts to about 80% of the outpatient healthcare services. What are all the future drivers? Future drivers are health insurance. Although we are only 1/10 is covered. Today, I understand from New India and other health insurance companies like Apollo Munich, 25% of their health insurance premium comes through the premium comes through the health insurance. And Apollo Munich says that they have made a turnover of about 775 crores, which is not a small amount. And growing middle class and the voice of the civil society is also impacting this healthcare industry. And infusion of private equity in healthcare funding. For example, in the hospital like where I am working, private equity is also involved, and so they look at the governance, they look at productivity, they look at the quality of care, which in many hospitals does not happen. And of course, the rapid advancement in medical equipment, in information and communication technology has had a tremendous effect on the quality and the kind of care we deliver. I think we should look at people like him. You know, I've always thought that whenever we are trying to do something, we shamelessly and keep doing the same thing over and over again, expecting different results. That does not work. But that way, technology has really helped us. And Nightingale also made a hospital a profession. I think in a facility, in a session like this, it would be a little unfair to talk about healthcare without talking about medical records. Electronic medical records have become the norm, but unfortunately in India, although we talk so much about electronic medical records, we are not using medical records. So I quickly pass over by saying that only about 5% of the Indian hospitals have anywhere near the electronic medical records, but a lot of IT companies have started establishing their medical records in this fashion. Then another interesting area is that laboratory integration. Now laboratory investigations are very, very important in diagnosis and treatment. In those days, we didn't have much of the equipments, but today we have auto analyzer, we have blood cell counter, blood gas analyzer, and all these equipments were all used, but they were not integrated. They didn't have barcodes, and if in some of our hospitals we almost see about 800 to 900 samples each day, and all those were manually recorded and things like that. But with barcodes, laboratory integration, things have changed a great deal, and you see the kind of samples, the number of samples we are talking about. Biochemistry is about 1,200 samples, clinical pathology and all that. All these things have been barcoded, and this has made the life of the technicians, the doctors, and the laboratories very simple, and medical errors have come down substantially. And we are talking about E-enabled ICUs. We have the best of the equipments today, but unfortunately we have problems of doctors. We don't have good intensivists, we don't have good nurses. So we have now come out with solutions where through the DICOM connectivity we can connect all these laboratory equipments, and we have an intensivist like a back office. He looks over the nurses, looks over the patients, and he is able to directly give orders for tests and maybe change of medication and things like that. These have also become a common. In fact, in Trichy we have a Geetanjali hospital which has the E-enabled ICU which operates from Chennai. I think these are all some of the devices which have become very popular, the portable devices. And this is one area which I thought I should tell you. Barcoded plastic cards have revolutionized the healthcare in India. And people talked about RFID. If you go to Google and see use of barcodes in hospital, there is a beautiful white paper how we could cost effectively use barcodes, whether it is in diagnostics or maybe whether it is in identifying a patient or maybe doing the surgery in the correct eye or a leg. All these are possible, and here in Trichy, in a tier 2 city, you find the computerization has been done so effectively, and these are the kind of barcodes we give. And these barcoded cards help us to track the medical records, make payments, issue materials, issue pharmacy medicines, even use them in the canteen. So I think that way, this was the first patient we got, and this was a barcoded plastic card, and this becomes the reference for the each patient. And what was stunning is, even in All India Institute of Medical Sciences, when I went, I studied for about almost 1 week there, and it was exciting to see the kind of crowd. Maybe a person like me who works in a corporate hospital sees about 500 to 600 patients a day, outpatient. But what is amazing is there in a hospital like AIIMS, they see about 5,000 to 6,000 patients. And for this, we require technology in such places rather than hospitals like us. And what is very interesting and very satisfying is that in All India Institute of Medical Sciences, they have started using technologies like this. They give computerized cards, and they collect money, very, very nominal fee as a registration, and they charge only about, say, 5 rupees or 10 rupees for ECG, and they keep a track of these patients. And in a hospital like Meenakshi Mission Hospital, where they get about 500 to 600 patients, before they introduced the the barcoded cards, this was the kind of chaos that was prevailing in the OPD in the morning. But believe me, after these computerized cards were issued, everything was automatically tracked, and the crowd melted away, and this is the scene in the morning. These are all some of the, of course I'm going to leave the presentation here, in different hospitals, what are all the IT initiatives and things like that can happen in a group setting. This is another interesting area of technology. When I went to Germany, I saw this hospital. It's a hospital in Düsseldorf, and you see it's a virtual operation theater. So you hardly see any nurses there. You see only internists, and everything is E-enabled, whether it is raising the operation table or changing the intensity of the light or programming for a particular doctor for a particular patient, depending upon the height of the doctor, depending upon the obesity of the patient, or the maybe the blood values. The doctor can just, if you see on the rear side, you will see there is a monitor there, and he can set everything in that monitor. So if there are about 25 doctors practicing, and if each one of them are doing about, say, 10 procedures, different procedures, they can set for a particular doctor, particular procedure, they can set the settings and hardly require any of the nurses. Such things have happened, believe me, in India. You see some of the hospitals have started adopting, and this is one of the hospital operation theaters in India, whether it is PACS or whether it is monitoring or whether it is an IT-driven solution. Everything is available in India today, and India is doing very well. And this is a operation theater, an open heart surgery operation theater in Trichy, for your information. And another interesting thing that has happened in the infrastructure is the pneumatic pipeline system. 10 years ago, when I went to Germany and when I was trying to explain this pneumatic pipeline system in India, people said it won't work in India, it's very expensive. But believe me, by keeping on talking about it and talking the virtues of those pneumatic pipeline system, now every hospital in India has made it a part of the infrastructure facility. Before that, we used to transport medicines and medicines and lab samples manually, and these were the kind of laboratory trips we are making. And this was the number of samples we were transporting by hand. But today you find whether it is in Kobe Hospital or Trichy Hospital, the nurses just use these pneumatic pipeline systems. And you see this is a hospital in Trichy and Chennai, and this is our hospital in Trichy, which is what I'm trying to see is across the board, whether it is in Chennai or whether it is in Bangalore or whether it is in Trichy, everybody have started using this very effectively. And you see it almost about 1 to 2 kilometers of pipeline running across, and this is the central system for the pneumatic pipeline system. And we can easily track, and it is becoming a very, very interesting facility in the hospitals today. And speech recognition. In the last e-health conference also, where it was mentioned, the radiologist said that speech recognition software has really changed the way we deliver the results to the patient, because if there are going to be 400 scans in a hospital like Trichy or in Coimbatore, it was very difficult for a secretary to type out the reports. As we dictate, the reports keep coming, and it's an outstanding facility, and I use it personally. And this is a video conferencing facility where we use, it's a software-driven video conferencing facility which you use for board meetings, for maybe even telehealth, and this is a wonderful facility that is being used today. And even liquid oxygen consumption. Previously they were using it in cylinders. Today we get liquid oxygen piped into the hospital, and they were all using analog meters, and today they are using digital meters like this. And we get information dashboards in the hospital, and it all comes through the IT system. And what is interesting is when I have about 5 or 6 hospitals reporting to me, I consolidate all the reports, and on a daily basis I see how much of electricity has been consumed, about the maximum demand, the electrical units or the diesel consumed. Everything is available in one dashboard. And even new masters, when they are created, all those things come through the email. And even for supply chain management, it is used extremely well. We thought it can be used only in the automobile industries, but in the hospitals, when we have about 8-9 hospitals, everything is ordered online, and this is a very typical software that is being used in the hospital where we are working. And of course, touchscreen facilities have come, so people don't have to go and find out which room, what is the outstanding. All those things are done here. And previously we had these kind of sterilizers 10 years ago, but today this is the kind of sterilizing facilities we have. They are all completely computer controlled. We have a data logger facility, especially for NABH accreditation and all that. These are extremely useful, and you see we are getting all kinds of details, what temperature, what pressure, and we also get all the details. The mobile technology is used extremely well. When a patient has a lab result, we send it through the mobile. When a patient has an outstanding, we send the outstanding on a daily basis. Imagine for 250 patients, we send all these details through the mobile system. And the last, I think I should not leave the podium without saying about the comprehensive health insurance scheme. I told you that health insurance is going to be the driver. It is not the private health insurance alone, but the government health insurance. In the state of Tamil Nadu alone, it is about 750 hospitals are integrated. So many families are covered, and 850 crores is pumped in. And I understand from Andhra Pradesh government, they have pumped in 1,100 crores last year in the Rajiv Gandhi Arogyashri program, and it is all technology enabled. But for the technology, these programs could never be implemented in this country. Before the procedure is done, all the tests are uploaded. After the procedure, all the tests are uploaded, and the payments are made through the computer system. And today, the payments from the government schemes are much faster than the payments from these. You see, this is how the uploading happens. This is the smart card they give, the pre-authorization process, treatment process. And last, I have a friend to talk about the building management system, but still, I thought I should tell you something about the building management. This is the building management facility you have in Boston in Mass General when I went there. But I knew that I cannot do it here, but I was trying to find out if I can do something about it, buying it from some of the suppliers like Siemens. Siemens, we introduced in Koya Medical Center, so the entire chiller plant, fan, coil units, everything is organized through it. And I can switch off any fan coil unit from the central plant, and also the AHUs. But when I came to Trichy and Chennai, we introduced another system called the Daikin system. These are all the outdoor units, and this is a touchscreen facility, and with the touchscreen facility I can switch on and switch off any operation theatre or patient room or any place. And I have also integrated this with the HIS. So when a patient comes in, once the patient pays the advance, then the room is enabled for air conditioning through this interface system here. And this is room settings are made. If you change the temperature by 1 degree, we save about 5,000 rupees per day in terms of electricity charges. So through the high-touch system and the HIS system, we set the temperatures, whether it is in the operation theatre or whether it is in the patient room or in the consultation room. And all this is done through this, and one person does it. Of course, these are all some of the online monitoring of the UPS. So central UPS is there, and we can online monitor the status of the UPS. And this is the kind of equipment we have. And we also have some of the renewable energy sources which are used in the hospitals. And almost about 20,000 liters of water is done through this. And we got our award for using renewable energy sources in the hospital. Thank you very much for patient hearing. If you have got any questions, I will take. Thank you.